welcome everybody to Main Street Mental Health. I'm Shannon Paul. I have a guest today, Tom Graber. We're going to be talking about a specific technique that might be helpful for you, the viewer, or your loved ones. First things first, though, Tom, let's learn a little bit about you, the type of work you do. I know I've known you for a number of years now, but our viewers don't know you, and might be good to kind of just give them a rundown of some of your experiences and then also the type of work you're doing now.
Okay. Thank you, Shannon, and thank you for inviting me on your podcast. Um, so I have my master's in social work. I received that a while back in 1989. I worked in a private practice mental health agency for about 9 years, where I did, you know, individual, couple, family therapy, but primarily I did a lot of work with adolescents. I was pretty young at the time. Um,
I think we all
I
start there.
Yeah, right.
Mhm.
I learned my earned my LCSW,
Mhm.
at some point in the field. Um, and also part of what I did there was employee assistance program,
Mhm.
contracting to local area businesses, school districts, et cetera, to provide the full gamut of EAP services. I'm sure most people in mental health are aware of what those are. Um, Somewhere around when I hit my ninth year, I was actually recruited to join Motorola's internal employee assistance program, which during that time was the world standard of an internal company operated employee assistance program. All EAP consultants were fully licensed and employees at Motorola. And it wasn't just assessing and referring employees, it was doing a lot of threat assessment work if you had a troubled employee, and how to help management and HR facilitate through
Mhm.
those processes to, mitigate any potential, harm to property or people. A lot of training on how to recognize troubled employees and get them referred appropriately to be assessed and referred. So I was there doing that for about 2 years, and a lot of my work was with the human resources department, because they'd usually be the front line with hearing about something going on with an employee or an environment. Well, then I was recruited into human resources. Um, so I pretty much officially left my mental health profession and went into human resources. I will say that, what you're trained in and your mental health training and your degree and your knowledge never
Comes
never
in
leaves you.
handy.
It comes in handy, and
Yeah.
it did. And probably for the next 14, 15 years, I was in human resources. After Motorola, there was a couple other companies I worked for. And then at some point for me, um, it wasn't working out anymore for me in corporate settings. I wasn't happy, they weren't happy.
Right.
And I remember a time in my life where I had to kind of think about, well, I don't want to do this anymore. What should I do? Through a series of events, both personal and professional, it led me to get back into the mental health field.
Mhm.
Um, I was able to interview with Sam Overleen, who's the owner and president of Seasons Counseling, and um, I was immediately brought in to work there.
Mhm.
It was amazing. I thought, I asked him, what does somebody out of the field do for, 17, been out of the field 17 years due to, re-enter mental health? What hoops
Right.
do I have to jump through? And it was, come work for us. And, there's specific roles and things you can do that because you're not licensed in the state of Wisconsin. Oh, at some point I moved from Illinois to Wisconsin and all that mix.
Right.
Um, and I that's when I learned about comprehensive community services, the county funded programs that involve therapy, community mentoring, and a whole set of different
The
services and
wraparound team approach. Mhm.
wrap around team approach. And I took to that like um, like nothing. It just felt so right, so good, and I was back. I
Did you
was back.
have the question in your mind, like, is this a real job?
Yes, I did because, back in the day, it was sitting in the office doing therapy in a room. There was no community type of work involved in that. We were working with private insurances, or private payers, and that's how the therapy work was done. And although I have you know, nothing negative to say about that, but that was the job. And next thing you know, I find myself, working with people for, 2, 3 hours at a time in their community, helping them kind of get assimilated into the community due to, a whole variety of diagnoses they may have, from ASD to high levels of anxiety and depression, where they feel when they're in the community they can't function properly. And if I were to reel it up 5 years to today, that work has been amazing. I really got a whole new perspective of mental health work in a community setting, and how effective that is. So currently, I do a lot of skill development. My caseload tends to be a lot of young boys, with
Back to the beginning.
yeah, with ASD, conduct, the whole variety of issues you might see in kids from, I think I've worked with ages 7,
Mhm.
on up to people, who are adults, and just enjoying the work. And I also do outpatient work now, in the office, one-on-one in the office. So
You have
it's
options. You
been
have options. Yeah.
quite a great option. Yeah.
Mhm.
So happy in my own skin. Just love the work that I do. Love the place I work. This is not me testing out, oh shit, will I like this? This is, I'm in it, and I'm so excited to be doing this type of work again.
Yeah, great. Well, there was something that one of the reasons we were going to talk today was you've had some specific training on a technique that you have found to be helpful in your community-based services, probably as well as your outpatient services, that I was hoping to talk a little bit about today, as long as you have time, and that's called Acutouch, and that's something that I was not familiar with, but could you give us some information about Acutouch and maybe some of the techniques involved in it and how you've seen it be helpful.
Absolutely. So I'm currently an APSW, and have been so for 3 years now, and I'll be sitting for my LCSW exam soon. But
Hmm.
everyone in the field knows you have to get those CEUs, and you have to stay, trained on clinical issues, administrative issues, ethical issues, etc. So one of the trainings, I didn't know what I was signing up for, really, Shannon. It looked interesting, and I thought, okay, this seems neat. I'll take this training. It was virtually administrated, right, online. I'm sitting in my home
Very
watching
normal
this, and
now.
it,
Yeah.
um, there's two names for the technique. You'll hear acupressure, and then you'll hear acutouch, right? And then
Mhm.
it shares the same framework as acupuncture. So, for those of you who've studied or looked into acupuncture, have had it, it's well researched. There's points on the body, there's regions on the body,
Mhm.
where they use the needles to,
Right.
stimulate or relieve pain, etc. Well, this led to, people looking into just those points in the body, and that they found that by, touching, pressing, or tapping certain points in the body, it was able to provide relief, um, for things from, physical pain management, to anxiety, and to depression.
Mhm.
And the trainer, she was excellent, from the Northeast coast out there,
Mhm.
kind of incorporated, a way to use these touch points, and they're self-administered, right? The person doing it touches themselves. So it's not invasive. It's not a needle. You're
Mhm.
using your fingers, touching your body. Probably the worst thing you can do is press too hard, which you're not supposed to. It's supposed to be kind of a slight pressure to the body.
Mhm.
And she incorporated some kind of dialogue, that her patients would use while they're doing that, and while she's taking them through the various
A
touch
personal
points.
dialogue or a dialogue between the provider and the client.
A dialogue the client's having, well, I shouldn't call it a dialogue, but they are identifying a high area of stress or something that makes them angry or highly
Okay.
anxious. And they're verbalizing their dislike for that feeling and what's causing that feeling. while they're doing the touch points.
Okay.
Okay, does that make sense?
Yeah. Yeah.
And, as they're doing it, the provider will have them repeat that 3 times. So they're going to first start by identifying what is that thing that's really making you upset or angry. It could be something as simple as when somebody cuts me off in traffic,
Hmm.
I get intensely angry. I'm not talking about me because that's never happened, but um, I get intensely angry and I kind of lose focus on, doing the next right thing.
Hmm.
And even in your car, you could do this without distractibility, like texting or, you know, um, doing something that would take your focus off of driving. And what you would recommend in a point like that, let's say I was the patient, I would say, yeah, it's when people cut me off in traffic that really gets me mad, and I can almost start to feel the anger. She goes, okay, now 10 is intense anger, rage. You've become physical and out of control. A one, of course, is puppies and rainbows. So you're not,
Wild. Yeah.
you're totally happy. You identify on a scale of 1 to 10 where you're at right now. So let's say I said that gets me to a 7 immediately,
Okay.
right?
Hmm.
So what I would do then is I would put into words how much I hate it
Hmm.
when people cut me off, driving. I
Right.
really hate it. I just can't stand it when people cut me off, driving.
Hmm.
So you kind of come up with a set of verbiage, to kind of repeat over and over while you go through the process. Then you do that while you're doing the certain, touch points to your body. And I could demonstrate that right now if you
Please.
would
Please
like.
do. Yeah.
Okay. So, can you hear me okay?
Yes.
Okay, our screen froze a little bit, probably because of my internet connection. Um, so they recommend you be in a sitting position,
Okay.
whether you're in a car or a chair. And, when you're driving, your legs are out, which is nice because they say when you're in a chair to have your legs out.
Extend.
So I'm going to go through the touch points I was taught in the training. And these aren't the only Acutouch points on the body, but for the purposes of this exercise, these are the ones that they found are most effective. And then when we're done, we say, where is that now on a scale of 1 to 10?
Hmm. So kind
Um,
of pre and post
so
scaling.
I'll go through a quick example without being too tacky here. The
Okay.
first touch point is on top of the head. And I like doing, there's a tap or a circular motion. I like
Okay.
tapping. I hate it when people cut me off while I'm driving. Center of the forehead. I just hate it when people cut me off on the road driving. I get so angry when people cut me off while I'm driving. That's my temple. Now I'm going to go under the nose. I really hate it when people cut me off driving. Under the lip,
Hmm.
above the chin. I really hate it. People cut me off while I'm driving. The last technique is you're taking your hand with a closed fist, not tight. You can't see me, but I'm pressing it in to my side, just above the hip, behind the rib cage, and my feet are extended out.
Okay.
And I'm going to repeat, I just hate it so much when people cut me off while I'm driving.
Hmm.
Okay. I would do that 3 times, right? I'm not going to, for the purposes of this demonstration, I'm not going to go through the whole thing.
Okay.
And then, the provider would ask, okay, after that 3 times, you said you were at a 7 right before you started it because you actually felt the feelings you feel when someone cuts you off driving.
Hmm.
Where are you at now? And pretty typically, okay, I think you're going to find your clients report a lower number,
Okay.
right?
Right.
There's so much more to this in science and research and everything, but
Okay.
that is kind of the gist of it. Um, so I use this for every client I work with. Who doesn't have anxiety? Who doesn't get mad? Who doesn't get scared?
What's
Who
the
doesn't
most
feel
common
like
emotion that people like to use it for? Is it anger typically, or is it
anger,
anger?
anger,
Okay.
and anxiety, right?
Okay.
Intense fear, intense anger, right? And we know
Right.
oftentimes, a fear response often, could turn into anger if somebody doesn't recognize it first as fear.
Hmm.
So we don't have to do any psychoanalysis to get to some, layer of where did this come from. It is here and now.
Right.
You feel fearful, you're scared, you're anxious, you're angry, right? It could be you're preparing for a college exam. I hate how
Right.
anxious I get. I'm preparing for an exam,
Right.
right? And you go through those steps. And what was really funny was during the training, because she had us think about things and do it ourselves, out loud to ourselves. I fell asleep.
Hmm.
I mean, I was on my third cup of coffee, right? I was on fire. I wasn't tired.
Right.
And
Right.
I started getting drowsy. My head started bobbing. And no sooner did that happen to me, one of the participants popped on the call and said, "Hey, I just fell asleep."
You were not alone. Yeah.
I was not alone. And she's like, "Absolutely. It could create drowsiness. So be careful
So it
if you are
almost
doing this
promotes the
while you're
relaxation
driving."
response
Yeah. So I don't recommend doing it in a car, but I have found myself doing it in the car. Just sometimes I'm anxious about things that are going on in the world or whatever, and I
definitely
start
not
doing the
during
tap.
driving, right? Parked would be okay.
Yeah, just park, pull over on your
Right. Right.
break
Yeah.
and do it.
Yeah.
Um, so yeah, really good point. Why don't we pull over before we fall asleep at the wheel? But that's not a typical response. I mean, we were doing this
Okay.
over and over and over again for probably 45 minutes where we're practicing it ourselves and rating ourselves in 1 to 10. And,
Right.
probably after the fourth, fifth time is when I started to get drowsy.
Yeah.
So, clients might report feeling drowsy. They might just report feeling less anxious, more calm.
Hmm.
Maybe they notice their breathing has slowed down.
Would you say that
Um,
since you've been using it, is it pretty universal that you see a reduction in that number, in that
yes,
stud score?
yes, and I don't believe clients are telling me that just to appease me, but
Hmm.
they really do report that.
Even
I've
appear
had
that way.
kids
Yeah.
do it
Hmm.
who now practice it at home. They use it at home when things get tense,
Right.
and it's really cool because it's so usable and easy.
Yeah. Yeah.
Um,
It's immediate.
it's just
Ever
a
present.
different technique to use.
Hmm. Yeah.
So one thing I just want to add is
Sure.
these points in the body, targeted with pressure, are to stimulate endorphins, right?
Okay.
That's what it does. It
Makes
stimulates
sense.
endorphins.
Yeah.
So, as many know, that helps with pain. Physically, that can help with emotional pain. That can
It's
help with
relaxing.
stress.
Yeah.
Yeah, and it's
Mhm.
very relaxing.
Right.
So it's something they could do at home. Of course, if you're pregnant, talk to your doctor about it. It's the
Sure.
usual,
Qualifiers.
you
Yeah.
know, benefits and concerns. Just make sure, if you're going to do it, probably best to learn it from a trained provider,
Hmm. Right.
to do it yourself. But it can be done at home. It doesn't have to be just done in the therapy office.
Hmm. Right. A couple things that stand out to me there, and there's that, there's definitely a part of an approach is that talk about immersing yourself in a challenging feeling for an extended period of time, versus avoiding or running from a challenging emotion or state of being. This really, like you're saying, you're going through it 3 times and you're doing the dialogue to yourself about how frustrating, how anxiety causing, how anger causing some situation or type, situation is. So you're really kind of being alone with that feeling. You're not avoiding it, you're not running from it, you're not medicating it. You're right in it. There's obviously like you say, the endorphin release, which promotes a relaxation response. Um, you know, uh, that in of itself from a biological neurological standpoint is fantastic. And then you're delaying any type of response. A lot of times people get angry, they get that immediate rush of adrenaline and cortisols, corticoids, and they act out verbally, physically, whatnot. And in this situation, you're delaying that response. So just by proxy, just by taking the time to go through that process, it's kind of like, often when you get mad, don't say the first 5 words that come to mind. It's kind of like, because those are going to not be the best words, most likely. So it's kind of in a way, it's like it delays your response, and you're
Right.
probably more apt to respond, a little bit more civilly, given the situation. So,
And,
um,
like most situations too, that provoke intense anger, anxiety, fear, there's a delayed reaction, right? A situation happens, and the heartbeat and the intensity of the feelings
right,
could come, almost immediately, or it could delay, 5 minutes. So,
hey,
like you said,
hey,
if you're in a vehicle and, you know, something like that happens, you might be, not upset about it. And all of a sudden you start to feel some intensity, right?
right. Yeah, awesome. Yeah. Sounds like a very, for people that want to research it and maybe find a practitioner nearby. Sounds like you're saying highly recommended. It's another great tool and tool belt that, again, it's ever present. You can do it pretty much anywhere. And once you know the technique, it's probably pretty, easy to use, obviously.
Hmm.
And you're seeing results, out in the field, with your, the folks
Yeah,
that
I'm definitely seeing results out in
you're
the
seeing
field. It's
adults
funny.
and kids as well. Are you seeing
Well, yeah,
adults try it too? Yeah.
I had one of the kids' parents come in and say, "Hey, can you teach us this
Can you
thing?"
teach us that? Yeah. I
Yeah,
mean,
so I did it.
th-
I
th-
did it with both the parents.
that's
It was
awesome. Yeah.
it was very engaging.
Yeah.
And I remember one of the parents came back the following
How's
week
my
as a high
how's
high
how's my child calming down?
yeah,
What's
right,
going on?
as a
Yeah.
high stress job dealing with a variety of customers and stuff like that.
Right.
Oh
Yeah.
boy, this has been kind of helpful to kind of take the time out to do this so I can refocus and, work with the next customer without, having a load on my mind.
Right. Right. Yeah,
Right.
I mean, yeah, sounds sounds incredibly helpful. I appreciate you talking about it a little bit, and we wanted to give our viewers a flavor of it for sure. But you've gone over and above, of course, Tom, as you do in your normal,
Oh, my,
life and
thank
work
you.
life
Well,
and
well,
whatnot.
that's
So,
flattering.
yeah, well, I appreciate all you do, and thank you for sharing that with us.
Yeah,
Yeah,
I appreciate your, you know, hearing the value in it and wanting to dive a little deeper. And again, I just scratched the surface today. If people want to get full blown training in this, it's out there in a variety of,
good,
venues. So I
awesome.
highly encourage getting the training before actually doing it because it really is eye opening.
Yeah, feel comfortable coming back in the future to other Main Street mental health
I'd love to.
episodes and talk about other topics sometime. Sound good?
Absolutely.
Okay, we'll have you back,
Absolutely.
but we'll sign off for today on that, and we'll let you go. And you're a busy person, I know, so I'll let you get on with it.
All right.
All right.
You have a great day.
Yep. Thank you very much.
Bye bye.